Good morning to you, Saint Lucia, wherever you may be, those of you on island and those of you in the diaspora and the wider world. And thank you so much for joining us on this broadcast. We're in downtown Canada. It's a very, very special occasion here for us. And again, we're taking the national fight against COVID-19. We're taking it to another level as we have public vaccination for Pfizer vaccine. I'm Mr. Joseph, and I'm here with the effervescent one, Dr. Merle Clarke. And Merle was just reminding me, like 6 months ago, that we were here in February when we were rolling out the AstraZeneca vaccine. And now St. Lucia has this added component of Pfizer vaccine, and adding that to its arsenal in the fight against COVID-19. And so, Merle, we have a number of individuals who will be vaccinated this morning into the early noon time, and we'll be sharing a lot of information with you on the Pfizer vaccine, vaccination, COVID-19, and we're hoping that you too, by the number of individuals you'll be seeing here, hearing their stories as well, Absolutely. That you at home, that you are going to be inspired and you would want to join the rest of the St. Lucia population in protecting the entire country.
Absolutely. Thank you, Lisa. It's wonderful to be here again with you. 6 months it's been since that rollout of AstraZeneca. And as you said, a new tool in the arsenal. In terms of the Pfizer vaccine, we know when it comes to vaccination, it is really the best tool we have to get out of this pandemic. And another option, we know there's hesitancy. We know there's a lot of consultation that needs to be had, but another tool in our arsenal. And as you said, we do encourage St. Lucians to go out and get vaccinated. We will have, the stories of resilience. We let them know all of it. But we invite you this morning to view, to see who's here to get vaccinated. Of course, the rollout started on Monday. That was August 23, the actual rollout of Pfizer. And there's been quite a positive response to that. And we're hoping to keep the momentum. We have, this fight against COVID-19, this pandemic, this is a country effort, this is a global effort. That indeed we need personal and collective responsibility to make it out of this pandemic a stronger, more resilient nation. So indeed, I'm glad to be here today. It took a lot to maneuver, for now, what you call, to be here, but we understand the importance of this, and that's why we're here this morning.
And I just want to thank you, Dr. Merle Clarke. Let me just say thank you for all of your service to country and to all of your members of the St. Lucia Medical and Dental Association. That the jobs that you guys are doing, it is a bit important.
Absolutely.
Important just does not begin to encapsulate what you do.
Absolutely.
Saving lives, giving individuals a second chance at living. Thank you so much for all that you do on a daily basis, and especially at this time with COVID-19, the pressure under which your members are functioning. I can't begin to wrap my mind around how much of an intense situation, conditions that you face in.
Yeah, it is a lot, and it has been a very difficult 18 months. Our colleagues, particularly at the respiratory hospital, they have had a hard time of it, and with this current surge, there is fatigue. Unquestionably, there is. We're humans at the end of the day, but we took a vow. We understand that there is a job to do. We understand that we are here to serve the public. And so we continue. We fight on, but we encourage you, St. Lucians, and we urge you, and we beg you to fight with us. We can't do it alone. We need you to do your part. And a big part of that is getting vaccinated so we could return to some semblance of normalcy sooner rather than later. But as you said, our members, what can be said? The mental health impact sometimes, it is significant, and we don't always pay enough attention to that. But so many members, the names are too much to call. But in terms of our staff at the respiratory hospital, Dr. Giffard, Dr. Chi, who've been there from day one, we just have to say a huge thank you. It's a debt that we as a country can never repay. But we continue to work in your interest, St. Lucia. But again, we ask you to work with us to fight this pandemic.
And just before we begin to roll out, just to extend on what you're saying, because not just those at the respiratory hospital, even at the OKEU and the other facilities as well, because COVID has put every other disease on a back burner, but these individuals who have other conditions are deserving of that attention as well.
You're absolutely correct. And this third wave of COVID, which was spoken of in the beginning, of course now we're seeing fourth waves and fifth waves in some jurisdictions. But the third wave that was spoken of initially, because The optimistic view of this was that in 6 months, hopefully we'd get out of this. Obviously, we're 18 months, we're still here. But the third wave that was spoken of was essentially of chronic disease. Chronic disease left, in a sense, behind because of a focus on COVID-19. And certainly there was the push by all the reputable agencies, the WHO, PAHO, that did not happen. We needed to ensure, in as much as possible, that measures were put in place, that did not happen. We can't fail to treat patients with cancer or kidney disease or heart disease. But if we continue to see a rise in cases, inevitably, you're going to have some of that happening, and we want to avoid that at all costs. Every citizen deserves the best health care, and we should have be it beds available, be it staff available to do that. But the more patients with COVID-19 that you have, of course, being hospitalized, and as we're saying, patients who are not vaccinated form the very large majority of patients being hospitalized. So to do your part to ensure that patients with chronic disease are not behind, please get vaccinated.
All right, and so we'll get today started for you. And we want to speak with the immunization manager within the Ministry of Health, Wellness and Elderly Affairs. You've gotten to know her in the last
tired must be
18
tired.
months. Absolutely. Lucia Baptiste is with us as we get this morning rolling. And as I indicated, we have a number of individuals and young children as well who are coming in because Pfizer vaccine is available for children 12 and up. So we've seen the rollout on Monday. You talk to us about how the ministry feels about the uptake of the vaccine, which has been very encouraging to see individuals really go out and bring along children with them.
Yeah, hi, Lisa, Dr. Clarke. I mean, it's really a special occasion to be here today, and today's event really is to boost the confidence of our people, you know, particularly Pfizer vaccine. As you said, we were on Monday, and I have to say that the uptake, the response has been very encouraging. Why do I say that? As you would have known, over the last 6 months, we rolled out AstraZeneca. We continued to see very high uptake amongst our older persons 50 years and older, and then those 25 and up to about 50 years. And seeing our lowest uptake amongst our young people, we know how much young people interact, and we see, of course, the statistics, especially in the US and other places. Right here, we see our young people, you know, being affected. So having Pfizer now, you know, and seeing the rollout and the response, we now see that more of our young people are responding, and this is a very positive thing, and we are happy about that. Today, of course, we have many parents here with the young ones, and of course, this is really to show the rest of the population that parents trust their young ones. They see the need, they see the importance of having them protected. The Pfizer vaccine is effective against the virus. We know that it is effective against the Delta variant, and we know how easily transmissible, you know, the Delta variant. Of course, you know, our young children will be interacting with each other, so it is very important that our young children especially get vaccinated and get that protection they need against the virus.
And just to indicate that for our viewers, and we're watching, we have the nursing station set up. There are 2 of them, and we can now see seated there. We have Dominique and Ava George, and speaking about parents, bringing in the children, the daughter and son there of our Chief Medical Officer, Dr. Sharon Belma George, her children leading off, opening the baton this morning.
Absolutely, and of course, Dominic would have topped common entrance. Was that last year? Time flies by so quickly that
I know.
you get lost. So Dominic, the brave boy, at the table now, about to receive his Pfizer vaccine, and as we wait for that to happen, Najama, please, with reference to dosing of the Pfizer vaccine, is the dose the same for children as it would be for adults?
Yes. So the recommended dosing is 0.3 mils. It is standard across. It is both for children and adults.
Okay.
Yes.
And you said it is effective. It's been shown to be effective against the Delta variant. So we could trust by the increased transmissibility of Delta, we can trust this to protect our children and, of course, the older people.
Very much so, very much so. The Pfizer vaccine has been shown to be very effective against the variants.
And in terms of storage, because one of the impediments to having this vaccine, quite apart, of course, from demand early in this pandemic or early when vaccines first came out, was storage of this particular vaccine. How have we been able, now that we've procured it, we obviously have storage facilities for it.
Yes, we do.
How have we been able to do that?
Okay, so we know the Pfizer vaccine is on cold. It requires ultra cold storage. But the good thing about it is that it can be stored at our temperatures for about 31 days.
Okay.
So the logistics surrounding the Pfizer distribution to our points of service has to be carefully done. So the bulk of the vaccine, of course, is in central storage, at the ultra cold storage. But when we move and then we take it across to the various centers.
Okay.
Yes.
All right. So we do have a plan in place for that in the logistics.
Yes, definitely.
Have been worked out. This is why I say
Logistics-wise.
you're tired must be tired. You're tired must be tired at this point. And in terms of this, so we would have heard it was Monday, I believe, that full FDA approval
Yes.
was granted for Pfizer vaccine. So tell us, Lucia, a little bit about that. What does that mean? What are we hope this particular bit of news, what are we hoping for as it pertains to this vaccine, and how much of it do we have?
Well, I mean, over the past 6 months, having one vaccine, and of course, starting off the rollout of vaccines, emergency use. There has been a lot of talk about not being FDA approved and emergency use listing, etc., etc. And of course, that too causing a bit of hesitancy. We know that too would have caused a bit of hesitancy, and that has contributed to the low uptake we saw at some point in the vaccine. Also, we know there are other causes of the low uptake, but there has been a lot of discussions around
a lot of discussion.
But I just want to assure people that the approval for vaccines, when a vaccine is introduced to the population, it would have gone through the required the trials and the right before it is approved. So even if a vaccine is approved for emergency use listening, it would have gone through the process.
It certainly does not mean that it's unsafe, as some
That's
people would
right.
like to
Like some
insinuate,
people would want
or
to
it's
think.
experimental, that it's gone through the trials.
Definitely, it has gone through the trials.
So I think perhaps we need to do a better job of explaining in a sense what emergency use is. That being said, Pfizer certainly has received full
FDA approval, and this is good,
certainly. So that should add to that. So we see Tristan at the table. I see Mommy moving around a lot. Not quite sure what the delay is in his being vaccinated, but he will be the first person vaccinated here this morning. Age group for Pfizer, because AstraZeneca, by the way, we are still doing both vaccines simultaneously, AstraZeneca and Pfizer. The age group for Pfizer what is the age group that can be vaccinated?
It is approved for persons 12 years and older.
So school age children
can be vaccinated. And we are really encouraging, we are really appealing to parents, especially school is going to be reopening, and we know the interaction between children. I mean, you could tell a child, to social distance, but we know the reality when they get to the school.
We're social beings, and children
I
more
tell
so.
you, and we are social beings and we interact.
Yeah, realistically, they're not going to really
definitely. So
and that protection is beginning now, because at the table, at the nurse's station, we can see the nurse there preparing.
They said they would get the nurse's name today. Remember, we had Sunshine last time.
We had Sunshine last night.
No,
Don't know quite sure which nurse is with us today. But we can see that Ava is, being held there by Mother Dr. Sharon Belmont John.
Yes. So today we have with us Miss Almadullah.
Oh, Miss Almadullah spotted this morning. She's from the community.
Yes, right. She's one of the assistant principal nursing officers.
All right.
She's very, very supportive of the immunization program.
Absolutely, she is.
Yes,
always
definitely.
Enthusiastic, always supportive.
Energy
for days.
Full of energy.
Yeah. So
and of course, we have with us this Andrea John.
Andrea John. So let me see. So we see. I'm seeing Tristan. I wasn't seeing Ava. So twins of Dr. Sharon Belmont George. First at the table. Is Ava receiving a vaccine?
Ava is preparing. to preparing
so
that
there
arm.
we go.
Yes,
At all
and-
important moments. As Ava
But talk
receives.
us about the for the young children, because some people think my child is only 12, giving my child a vaccine, this thing that has just come on the market. We talk about its efficacy, it's being safe, we've seen the trials, but would the young children be seeing any sort of side effects? We know that when we had AstraZeneca, the normal little side effects of the soreness at the injection site and so on. What side effects are there to be known with the Pfizer, especially with children, if there are any?
Basically, like any other vaccine, the side effects are sort of similar. What we have seen is the same fever, the malaise, the fatigue, the headaches, if they have any body pains, etc. So generally, it's about the same side effects. Of course, we continue to encourage the parents, to how to manage the fevers, if at all. Ensure that the kids are kept hydrated.
Yeah.
This is very important. It is very important, especially if a child has a fever, to keep them hydrated. So it is important that they have paracetamol. So after,
Just like you'd have for other ailments that children tend
That's
to get.
right, that's
cough,
right,
important
yeah.
fevers,
and like the AstraZeneca vaccine, these side effects, if at all they experience any, they're normally very mild to moderate and would go away in about 12 to 24 hours.
So we see Ava there, and we'll ask you if symptoms persist, what should patients do or parents do. But we see Ava there, so will she be observed? So she's received a vaccine. Is it the same observation period for the AstraZeneca vaccine?
Yes, definitely. So after the vaccine has been administered, they would move on to the observation area where they will be monitored for about 15 minutes. Yes,
All right.
for any sudden onset reaction or anything of that sort. Of course, the monitoring continues because we know people have delayed reactions, and some people take a while before their bodies could react.
But that's initial.
Yes.
Yeah.
So of course, parents are encouraged to continue monitoring their children, and if they were to experience anything, that they should contact the nearest wellness center.
And children, like the adults, are getting 2 of the Pfizer
Yes.
vaccine.
So the interval between the doses is it could be given 21 to 28 days, but for us in St. Lucia, we've added 28 days.
Okay, so that's shorter than AstraZeneca. Which
Yes,
is
yes.
All right, so there is the hero Tristan. So he's received his vaccine now. So he moves on to observation now. So Mommy Sharon Belmar George there with Tristan George, our second vaccine candidate. Vaccine candidate, that's what they say for the actual vaccines. Our second vaccine recipient this morning. Tristan George, student at St. Mary.
Dominic.
Where do we get Tristan from?
We do have
Tristan.
We have a Tristan with us.
We have a Tristan, that's
Later
right.
on, later on in the day.
That's to say a whole
Dominic.
Dominic George and Ava George. So they have been vaccinated. There's Mommy there. You know Mommy, like a mama hen.
Give the
Comfort there. So I still thought Tristan. I wonder, maybe Tristan, maybe that's the love of my life. Tristan, who knows? I don't know. You never know.
That's a sidebar. we need to have that sidebar conversation, yes?
All right, so at the table now, who do we have? Lisa?
And we are having the vaccination there for
Eva
Regis. Eva Regis is...
So we don't have an age for Eva?
No. Looks young enough, perhaps in the teens.
And I see walking up to the table as well, the son of Dr. Charles Greenwich. That's Charlie Greenwich. So Eva Regis and Charlie Greenwich at the table. But Tekla, before we went, so while we wait for the vaccine to be pulled up by our competent, hard-working nurses, I think, Lisa, you were asking, I remember what you were asking Tekla at the time, I think, the side effects. So parents have to continue to observe after the 15 minutes, the initial 15 minutes, for any potential side effects. And if that were to persist, say past 3 days, or if the fever were to be very high, if somebody does have fever, and it's to be very high, it's not coming down with your usual measures, what are parents supposed to do?
So, of course, the next step is to contact your nearest wellness center or your medical practitioner. And this, of course, is reported, and it would be documented, a notification would be sent, and of course we would follow up the case.
All right.
Yes.
So there is something in place for the
Yes, there is
notification.
yes, there is what we call surveillance system in place.
All
yes,
right.
there is an established surveillance system, and of course this is for us to monitor any adverse events. It could be either mild, severe, whatever. But if any adverse events were to occur, we have to monitor. We have to follow up, of course, to be able to determine causality, of course, if it is actually associated with the vaccine.
I want to thank you so much, Jacqueline, for sharing that information, and we know that the work doesn't stop here
At all.
And it has actually just begun.
And so we thank you so much for that. Standing by, we have Dr. Merle George, who's
Thank
going
you
to
so
speak
much.
with us for a short while. And we can see that the nurses station filling up there quite nicely. We have the vaccination of Mia Amadei taking place right now. If you guys are looking up at your screen, and we could see that Charlie Greenwich is still there.
So that'll be
waiting
Charlie
the
Greenwich,
jab.
because that's not Mia Amity yet. So I think we got a mix up here
mix
a
up
little
there,
bit,
little
but
mix
we'll
up,
figure it out.
So it is.
Yes. So Dr.
Tatiana.
Sharon George, in her capacity as mommy.
As mommy
Sharon,
first.
Mommy Sharon is here with us today. Good morning, Dr.
Good morning, Dr. Clarke.
How are
and Ms.
you?
Joseph. I'm good. I'm relieved.
I can imagine. I can imagine. So we see the babies looking over eagerly. They look to be quite fine. So
Yes.
Eva, for some odd reason, I was calling him Tristan.
But we wouldn't tell you what she said after that. But how did you prepare the children? Because I think, children, and sometimes we gloss it over, but children do have concerns of their own. They hear discussion out in the public arena.
Yes.
So how did you prepare the children, and what are some of the questions they had for you?
Yes, I think this is so important. Well, today I'm here as mommy and not as Dr. Velma George. I think for parents, and all parents want what is best for their children. And even as parents who took the vaccine, when it comes to your children, you have an extra layer of caution and protection and fear. So it's important, first of all, to ensure that you discuss with daddy or mommy, make sure everybody is on the same page in relation to the vaccine. If you have any concerns, speak to your pediatrician or your family doctor or somebody medical, especially if your child may have certain medical conditions that you might be extra concerned about. So you can also get that extra layer of advice from them. But it's also important to speak to your child and to ensure that they agree and that they understand what taking the vaccine means. 12 and up smart children who think for themselves. There's been so much from school, from the radio, from TV about the vaccine and about COVID. So it's important to get the buy-in and to get the fears. And every single child is different. So when I did have the discussion with mine, and normally I'm like, this is good for you, you have to do it kind of thing. So I had to sit back and say, okay, you have to listen to them. And Ava was okay. She was like, yes, mommy, okay, and thing. But Dominique has a legal mind. So I got 1,000 questions. I had to interrogation, and I was told I'll think about it. And I was like, this child wants to embarrass me. Think about it. So I gave him his time to think about it. But the bottom of his fear was really the needle and not necessarily the vaccine. So once you indicate to them what's going on and why it's important, and if you get COVID, there'll be much more needles than just this one. So let's take one needle to prevent you from getting into respiratory hospital, especially with the Delta variant. That's our fear, that younger age groups get affected now. And when you listen to what's happening and you review what's happening around the world, it's of concern to us that there may be younger people. I mean, we don't want anyone to get sick.
Absolutely.
But in terms of our preparation at what we need for our at-risk population, it now widens it. So it means our health sector has to be prepared to manage a wider range, a greater number of persons due to the effect of the Delta variant. So looking at what is happening with young people, I couldn't wait to get my children for the children of everybody else. One of the things which I want to make it very clear to parents, that just as we do in the health sector for children 18, we will not give the vaccine unless we get the consent of the parents. So we provide you with information, we guide you, your private physicians, your public health physicians, your pediatricians. will assist you in making the decision, but the decision is that of the parents. So at no point we will give a vaccine without a consent. It is a requirement to get the vaccine that we have the parent or the guardian there. But for us it's important because the kids were involved before COVID in swimming, in dance, in football, in all those extra activities that we had to curtail because of COVID. And safe going back to school as well is of concern. So now our secondary school environment could be a lot safer if we can get a level of it. But like we said, we are providing parents with the information to guide them so that they can make the right decision and to, we understand the fears as a parent. You will, even if you took it, you'll now say, this is my child, which should have an extra layer of protection for. So we are really hoping that we can work towards that so that school reopening can be a lot safer.
Okay. Do we have a target for sort of herd immunity amongst our school population?
Yeah, well, the target for the original strain of COVID was between 70 and 80%. What the public health researchers are saying that for Delta, because of the increased layer of transmissibility, it could be as high as %, which really raises the bar for us now, meaning that for us to feel safe, we need to have a greater proportion of the population covered with the vaccine. But so far it's been very good, and I just want to ask for the patience of the population, because on our part we've had great crowds coming and we're not able to, sometimes we've had to close and say come back tomorrow, which is not good. We've been asking people to come. We should not have to turn anyone away. So we are looking at that.
So the reason for closing would be that perhaps no more vaccines are available?
No,
at
it's
the
a
particular
time.
Sites?
No, we've not run out, but the time, because right now our hospital, we have increased patients. I think yesterday's number was 61 admitted persons, and at our respiratory centers we've seen increased persons because we have been asking people to go and get tested. So we've been seeing, we have been in contacts of cases, people coming for the 7-day test. So we've had to increase the manpower at our respiratory clinics as well. So our staff, and I really want to recognize the staff of the respiratory hospital, the respiratory clinic, our lab staff who've been going all hours of the night for the increased numbers to ensure we can keep to the 24-hour turnaround. And the other support services like ambulance and all of the rest. The teams have really been putting their all in managing this wave. So as much as we're looking at the possibilities of extending the hours and doing weekends, it really has been because of staff. So we are really working to see how we can get everybody vaccinated within the shortest period.
So thank you very much, Mommy Belma George. And we've had quite a few others vaccinated while Dr. Belma spoke. They all look quite comfortable in their observation spots. And
I think we'll be speaking with your children in just a few minutes there, just to get their thoughts on being able to get that vaccine today. And as we turn around, thank you so much for that. And we look forward to seeing you back on the work field wearing the official hats.
Yes, of Chief Medical Officer.
But we'll speak with Dominique and Eva George. And they'll talk to us about their experience there with the jab that they've taken earlier. They gently holding that injection site. Gently holding the all right.
Okay, so
I'll probably just scoot on over. Let's just do scoots.
Let's do scoot. Well, let's let you do this. You're the professional. Let's let you do this. Okay. Eva and Teresa's girl.
Have a seat right here. And let's just have a little chit chat. Nothing to I think it is certainly less scary than having to deal with the jab. What was it for you? I know Mommy said you had a lot of questions about taking the vaccine. You want to share what some of those questions were with us?
Sure. Okay, first of all,
okay. Does the arm hurt?
No.
You need a little help?
No,
okay,
the arm doesn't hurt that much.
Wonderful.
First of all, when I saw the vaccine, the AstraZeneca has been out for a while, and I was a bit surprised when I heard that there was now for kids.
Mm-hmm.
When I saw it, I was a bit scared, a little bit of the vaccine, but also of the needle itself. But I had to realize that the vaccine is what that it really helps people with, because what's going on in the world right now with some people getting COVID, it's the best option.
Best option to protect ourselves.
And with the Delta variant here, it affects kids as well. You really need a layer of protection. The pandemic has been out for a while, and I'm sure most people think that they're probably not going to get it anytime soon, but you never know.
We just never know, and that's the important, that's the unknown factor is what's supposed to drive us for us to be able to get that layer of protection. And for Ava, I'm sure that you'll be happy to be able to get back to school, and so for you, is that a key point, having to get vaccinated, you to be able to do your face-to-face instruction? Talk to me about you coming here and what were your thoughts?
Okay, so I came here to get the vaccine today because I wanted to be safe and protected, and my extracurricular activities and even going to school, I just want to do them knowing that I'm safe and protected by the vaccine.
And we are very happy that you made that decision, and you are shining examples to all of St. Lucia and to your peers as well, so that the vaccine, and it didn't hurt, did it?
It didn't.
It
Did it really hurt?
At first I thought it would, but it did not.
It did not
It really
hurt.
did not.
And mommy's comfort helped as well.
Yes.
Yes, I know that mommy's comfort always helps. And so we're very happy that you've made that decision. You came to that decision after receiving all of the information for you to have decided to take the vaccine. Thank you so much, Dominique and Ava. And we're looking forward to hearing about your progress when you're taking that second jab. Okay, thank you so much
you.
there.
You're welcome.
And the children there of St. Lucia's Chief Medical Officer, Dr. Sharon Belmont George, very well spoken, particularly the young children. Thank you so much for that. And we do have some other interviewees in the wings, and we want to welcome them. See what the children be saying, and pretty much that this is what we have as our layer of protection.
Absolutely.
And so let's just get that done.
And it's important that the children know that. It is encouraging that children realize that. Children listen more to children, perhaps. So if my peers are getting it, perhaps I should tell my parents that I would like to get this as well.
All right, so I'm going to just scoot over so that we can make some room here for Dr. Charles Greenedge and son Charlie. And so we will just want, so we share a little space here. Don't be. And as we can see, all right,
So Charlie and Charles Greenedge. Let's see, just turn around. Good morning.
Good morning, Merle. Good morning.
How are you feeling?
Fine.
You feel fine. So Dr. Greenedge, you would have had, just hold this mic here, Charlie. You would have had your AstraZeneca vaccine earlier this year.
Yes.
Tell us why. You're a physician, very outspoken, very vocal, of course, always encouraging St. Lucians as a population as to get vaccinated. Just do what it takes to get us out of this pandemic. Tell us why you decided to have your son vaccinated.
Okay, so, I mean, as was said earlier, previously we had the impression that it's affecting older people, and younger people really were not particularly at risk of getting ill. But that picture has changed drastically with the Delta variant, and now we see, even I saw the other day, a baby was admitted ill with COVID. So the Delta variant has changed the disease completely, and it's now important to protect our younger people because they too can get sick.
Absolutely. And as we spoke with Dr. Belmont, we asked about the conversation that was had. How old are you, Charlie?
16.
So Charlie is 16. How did that conversation go about getting vaccinated? Was it that mommy and daddy said, I think you should do this, or you decided, I definitely want to do it? So how did that go?
They said that, but there was no disagreement in my mind.
That you recognize the need to do this. We encourage your friends to get vaccinated. And as we asked, I'm still thinking Dr. Belmont's interest in Dominic in terms of why he felt. So we've asked you that. Of course, he knows why vaccination is important. In view, your 16-year-old view, why is it important to get vaccinated? Particularly the young people. We want you to now speak to the young people in St. Lucia, your age group.
I mean, you don't want to get sick.
Essentially. As simple as that.
Yeah.
As simple as that. So thank you very much, Charlie. And as you said, you don't want to get sick. What we're seeing is unvaccinated people, and you're seeing it in jurisdictions around the world, that the unvaccinated population is the population predominantly ending up in hospital, having worse outcomes, ending up in ICUs, having high oxygen demands. So we urge you all to get vaccinated. So thank you again. So his observation period continues, and of course his parents are physicians. If there are any issues, of course they will highlight that, so the ministry has a record of that if he has any side effects at all. So thank you very much, Charles and Charlie Greenwich. You can just press the mic. And listen, we will get you back as we continue. Let's see who's at the table now.
And I tell you that certainly the children will lead.
Absolutely.
And all of this time we've been hearing all of the discussion, opinions of the adults in the society. And it's good to see that the young ones, they themselves have their own thought processes. Absolutely. And that they've been able to come and be very articulate about that. And so you can see too that they are concerned about the future just as we are.
Yes, they are.
Because their lives have been turned literally upside down. And we heard young Ava speak about wanting to just do her activities.
Yeah.
The children want to be able to get back to the things that they love to do, just like us, the adults. You know, so when you think about your own, like as a student, as a child, there's just so much that you enjoyed, so much that you enjoyed.
Imagine having to essentially be inside for 2 years, 18 months at this point. So they do want to get back, to see their friends, to socialize, to go to swimming, and we can help the adults. We need to do our part to help our children, because again, the mental impact of all of this on our children has indeed been significant. So we need to try to get back as soon as possible to some degree of normalcy.
And I think we are awaiting another interview there, and I do believe we perhaps have Joshani Suraj, who is standing by to speak with, and Mummy to speak with us. And so we have his mom here with us, Mrs. Courtney Suraj. To just move over.
Yes.
And to have a nice little conversation with us. Thank you so much for being as brave as you have been for coming in. If you don't mind me asking, how old are you?
I'm 16 years old.
16, right at that age there where matters, especially having your own time and being able to see friends and being able to go out and enjoy a little ice cream, a little Sunday lime, right? Yeah, I got that. You would not see that saying Lucia, but the glimmer in his eye when I said Sunday lime. He understands. So for you, the decision for coming in, did you have any questions before you came in? Did you have any concerns? And why did you decide it was the best thing to do?
I didn't really have questions, but I decided to take it because it would better myself. I decided to take it because to be safe and to protect my family and friends. Yeah.
And for you, Courtney, for having him come through, was that an easy decision for you to make?
Yes, it was a very easy decision. Actually, I'm very relieved.
Put the mic a little higher.
I'm very relieved today because my family, my immediate family is 15 of us, and we're all vaccinated except him. So when I heard we were getting Pfizer, and I was out of state, I returned yesterday, and I told him, listen, today we have to make that decision. But it was a very easy one for me because when we were being vaccinated, my family, he did ask me. He could not have been vaccinated, and it was explained to him. So when I told him of this new vaccine, and I told him that, of course, he could have been vaccinated because of his age, he was very happy. And I am relieved because I know now that we're on the step to getting him fully vaccinated, protected.
Yes, and so your family made that very, very early conscious decision that everyone be vaccinated. Why was it so important for the entire family to do so?
Because my family, I live with in an extended family, and my grandmother, of course, her age, she is at risk, and my mom. So we have persons in our family with pre-existing conditions that I know that were at risk, and also myself. So we made a decision as a family, and we got vaccinated on the same day. We all went to get vaccinated. So he was the only one missing. So I am really happy that today he has received his first dose.
Now, I just want to ask you finally, you mentioned about just returning, knowing that you were vaccinated. Did you see, were you a little bit more relaxed? Did you breathe a little easier? Because we know that the vaccines do provide a level of protection against severe illness with COVID-19.
Well, yes, I was... Really, I would say, yes, I felt a bit secure. However, I still maintained all the protocols. I did not take off my mask when in public distance. So not because I was vaccinated, meant that I did not follow the protocols. I did the protocols, hand washing, sanitizing my hands whenever I was in public. But I mean, you feel a lot secure knowing that even if you do, at some point in time during your interactions with persons come across or get infected, at least you would not develop the severe form of the illness or be hospitalized. So I was relieved, yes.
All right, want to thank you so much. Thank you so much for making sure that your entire family took that conscious decision and you have extended it to your son. Thank you so much for doing the responsible thing for all of us here in St. Lucia for us to get back to our lives, back to that Sunday line.
Definitely.
Wonderful. Thank you so much.
Thank you.
Thank you. And we see the activity at the nurses station fast and furious there, and certainly the numbers are coming through. And we're happy that St. Lucians took that decision. We do have with us perhaps Tristan Obeas. No, Jabari Gabriel. Okay, there we go. You know, the mask makes it very difficult. The numbers are coming through. And so thank you so much for coming. Look how cool and easy you are. That was just a breeze for you, wasn't it? Yes?
Yeah.
All right, let's use the mic. All right, so tell us your name again and perhaps the school that you attend and your age.
Miss Jabari Gabriel. I go to the Leon Hess Comprehensive Secondary School and I'm
13 years old, so you entered Form 1?
No, Form 2.
Form 2? Oh, tell me, at 13, things have changed since I have been. So you miss school, don't you? You miss being able to free and be able to interact with your friends.
Not really.
You don't miss it? You like to do homeschooling instead? That's okay if you do?
I still talk to my friends, so.
The wonders there, father, of the technology, so he's able to stay home and not feel alone.
Very much into the talking via their games and stuff, so they're always in contact with each other. And so
but for some people that works very well, for others not. Some people really like the hands-on experience. But give us your name, Dad. Earl Gabriel. So talk to, for you making that decision to have him vaccinated, are you vaccinated?
I am.
And so it was easy to come to the decision to have your children as well?
Yeah, well, I wouldn't say it was an easy decision because, again, you don't know with the information out there, like Dr. Bellman said, a bit more skepticism when you're considering your child being vaccinated. But we did a discussion. My wife and I spoke to him to find out whether he was comfortable having the vaccine. He did indicate he wanted to do it, and he did his own research to find out whether they were enough to do it. And one of the first things he said to me is, but that is mathematics, so it'll be safer for me to take the vaccine. Just in case.
And you did your own research. I'm loving this. That means you can't this process, so that's very good. He's a critical thinker. What are some of the things that you discovered while you were doing the research?
Well, I discovered that first the vaccine was only for people 16 and older, and then later on they made it for 12 and older.
And so that was your indication that I fit right in there.
Yeah.
Wonderful. And so you are quite comfortable in your mind. Will definitely go a long way in protecting you.
Yes, it will.
All right. I want to thank you so much there. Thank you, Father, for bringing him in, and you are raising a remarkable young man. I'm very happy. You said that he did his own research. I'm very, very happy about that. And so now, although you love being with your friends just via your games and the electronics, but guess what? You'll be able to have some fun with them in person too.
Yes, I will.
Yes, so that's good. Thank you so much for coming through. We appreciate you. Appreciate all that you are doing for family and the extended national family as well. And so we can see once again, Merle, we
I love his confidence. I love his energy.
Well, I am very, very, very happy and to see that our young people, and he starts that he did his own research in order for him to feel comfortable. He didn't want to be told what it was. He needed to go and on white on, for him to understand. And I think too that sometimes as adults we underestimate the ability of our children
to
and there are sites,
certain things. Yes,
and then there are sites that children can go to where the information is quite child friendly. Yes. So that all of these big scientific terms are broken down and made things quite simple for them. So we're very, very pleased with what we've been able to see today.
And that's because, and again, the conversation needs to be had. We understand the importance of consultation. So he did his, and we do hear a lot of that. We do hear quite a few adults because, again, we try not to use the term anti-vaxxers because there are quite a few people who say they're not anti-vaccine because they've had
just want to understand.
Yes, exactly. So we understand that and we try to refrain from using that. What we do want to caution in some cases, as you said, they're child-friendly sites, so children perhaps could understand, but there are sites which are a bit more complicated, and even us physicians find it hard to discern information, to decipher what is true and what is not. Consult a lot with our colleagues when we see certain bits of information, so sometimes it can be a tad scary when you see a video on WhatsApp, on Facebook or somewhere, and everybody's just commenting and just believing it. Just adding a little snippet of truth to something does not necessarily make it true. So we want to caution St. Lucians against that.
And being able to do that. And so at the nurses station, we will be our last individuals taking that jab. I'm not quite sure who is at the table, and perhaps we can be told who's at the table, who is our last individual at the. And we have Ariel with Ariel Caesar is our last individual for this session.
Yes.
And as I indicated, we had quite a number of young persons coming through. I do believe we had a brother and sister combination, Jani Diamond and Junior Diamond, 15 and 14 years old. They were able to come through and be with Tatiana Clovis Freitas, who was also here as well, and Tristan Obeas was here, Ayani Lewis as well. So we're very happy that the youngsters
and they look very happy to be doing their part. I'm not sure if they can be seen off screen, but I think everybody here recognizes the importance of this. We all must do our part to bring this country back, to get out of this pandemic, to return to essentially what we know to be normal, what was pre-COVID. Because now we can refer to pre-COVID and post-COVID, that we all need to do our part, and the children, the young people look very happy to be doing their part here today.
And so in the observation section, they're quite filled, and they will be receiving their cards, Merle, so that they can return for in 28 days, 21 days, 28 days for us. There's the option of 21, but we have decided to use the 28-day waiting period there in between your doses, and they'll be receiving their cards for the exact date as to when to return. And of course, that vaccination, the second dose can be taken at any vaccination site.
So the vaccination sites are posted weekly. In fact, they're standard now. So, every Monday is Vigi and so far, I believe. So it's easier now in a sense to know. So that can be done. And we urge St. Lucians again to get vaccinated. If it's your first dose, you need to carry the child's birth certificate or some form of identification, a passport, or something to that effect. They must be accompanied by a parent. That is important. And of course, on the day of vaccination, after the initial 15 minutes, you're observing for any potential side effects, fever, pain, fatigue, anything that that children present with after they're vaccinated. Of course, for your second dose, you'd have to bring in that vaccination card because there's documentation that needs to be done. And as our Chief Medical Officer had said in the past, the immunization cards, electronic immunization cards, will be rolling out, and of course that is to reduce the odds of fraud, which we certainly don't want. We genuinely want to have the conversations, and we want people to actually get vaccinated, that there should be no fraud in this. We need to protect each other, we need to protect ourselves, so our country can return to normal.
And we want to be able to have that card as well for us to enjoy the sort of, I don't want to necessarily say liberties, but certain activities you want to be able to go in. We want to be able to know that if we are going to have a sporting event, that we can have X number of people who are vaccinated, who can go and enjoy that particular event. So we need to be able to come to that point.
Yeah, and brunch. I mean, people haven't been to brunch. I love brunches. It's a fancy and wear your flowery garden dresses, and we want to be able to go back to that. Those are the realities. CPL actually starts today, and I mean just so we see what COVID-19 has done. CPL this year is just in St. Kitts. I mean, we just all have to watch it on TV. There's no excitement of cricket played louder. So COVID-19 really has impacted every single individual globally. Nobody has been spared, so we all have to do our part. It's back to what we know to be normal.
Yes, and we've just been notified that we have the Honorable Mayor Norbert with us, and he is, and he will be taking that jab today. Yes. And he's decided to take that Pfizer jab, and so we'll be hearing from him as well and to the decision for that. But he's going to make his way to the nurses station, and for his
story of resilience, a story of hope, really an inspirational figure here in St. Lucia, the Deputy Speaker of the House, Jeremiah Norbert, married to one of our physicians, Dr. Reynolds. So, you know, family. Family. It's one place.
We're all family.
And we are all family. So St. Lucia, again, I mean, the age is what with Pfizer. The difference is that it can be given to younger people. We have options now. I think we received over 56,000 doses of the Pfizer vaccine. So that means we'll be able to vaccinate. Let's say you do the math. Half of 56. Half of 50 is 25. Half of 6 is 3.
So
that's 28,000
people.
Individuals with this initial batch, a generous donation from the government of people, United States of America.
And we are indeed very grateful to be able to be considered with the rest of the CARICOM, some of the CARICOM countries receiving this. There is a first tranche, there is a second tranche that's coming, so there is more on its way for us and able to give us again options. And I think so that's one of the things that the St. Lucian public was concerned about. Why is it that we do not have the options? But there are many factors that go into a lot of networking that goes into being able to procure and secure those vaccines.
Demand, supply, the networking, and you spoke of the storage issues with Pfizer. So there really is a lot that goes into it. And we hear a lot of talk still because what we don't want necessarily as a nation is for the goalposts to be moving every time. So now we have Pfizer and you hear some people say, I'll wait for the Cuban. And as I have said multiple times, I'm a product of the Cuban healthcare system. I mean, I studied in Cuba, I specialize in Cuba, and I believe in Cuban medicine. But the reality is right now, Cuba is having a huge surge. This is the worst numbers they've seen since the start of this pandemic in terms of hospitalizations. I mean, to hear Cuba's healthcare system being on the brink is something unheard of practically, but this is what COVID-19 has done to even the most robust healthcare systems around the world. So the reality is they need to, and as it should be, prioritize their people when it comes to vaccination, so they can't yet provide vaccines to anybody.
To the rest of the world.
To the rest of the world. So as soon we know Cuba is generous, and as soon as they can, we're pretty sure that they will. But as it is, they can't yet. So we have to use the vaccines which we have available to us. The best vaccine is the one that's available to you right now to prevent hospitalizations and to prevent death. So that is important to know. It's not a question of, I think, the ministry not putting in the work to get all possible options. So the Johnson & Johnson vaccine was being looked at for some of our less fortunate people who are afraid of needles. It's one shot, as we know, so far. So all those factors have to be taken into account.
And cost is also an issue as well, because while we may be getting a portion by way of donation, you know that you would have to pay to receive additional vaccines as well. So
that the country would have to pay.
The country would have to pay. The country, not the individuals. But the country must bear the cost.
Absolutely.
And for that. And so now we're seeing Honorable Jeremiah Norbert there at the
sleeve
table.
is going up. Look at that shirt, the flowers and the white. That sleeve goes up, and they're the capable hands of Alma Dolor. They're about to do the honors of the Pfizer vaccine to the Honorable.
Is it a drum roll? You're almost having a drum roll feel, right? Drum roll feel here.
And there you have it.
Lots of
St.
photographers.
Lucia. Yeah.
off camera, lots of photographers are lining up for them to be able to get this done.
There you go.
And we'll be having a little conversation with Honorable Jeremiah Norbert once he's able to get there.
Yeah.
But we know that the Delta variant, as we've indicated, the Delta variant is here.
Yeah.
And which is why the urgency is there for us to get ourselves vaccinated.
Yeah.
It is more contagious, thus transmissible.
Exactly.
More
Significantly
transmissible.
more so. And again, there have been many questions about, is it what's spreading? And the assumption can be made. But as we've said several times, and as our chief medical officer has said, I mean, at the end of the day, we're science-based practitioners. You don't just say things based on assumptions. Yes, with science, you look at trends because of the numbers, and it's possible. But the reality is, on a monthly basis, CAFA only allows 10 samples per member state. And even then, there's some outsourcing that's done in terms of gene sequencing. Those are expensive things to do. So the reality of Little Island having that capability is simply not realistic expectations. So with just 10 being sent over, sorry, my Maria Goretti mask. Listen, don't think we're getting away from here before I mentioned Maria Goretti today. I'm dressed in green for green mask for a reason. But yes, back to the point that there could be a delay in the actual identification of the variant, but it is quite possible that it's circulating, and it's been circulating, and that's why we're seeing those huge spikes.
The numbers there, the younger people,
yes, the younger
who are affected, and we see the deaths in younger people as well.
A 25-year-old from yesterday's report. So we are seeing it. We are seeing it at the respiratory hospital. So it's not a question of us having to get data from overseas. We see it with our own eyes.
It's happening to us. It's happening to our friends,
so
our family,
yes,
our relatives, an acquaintance.
Absolutely.
You know, so we know a neighbor. So it's now
everybody at this point knows somebody
knows someone who has been affected by COVID in one way or another.
I'm the eternal optimist. So the way I view it in part is the stigma perhaps is no longer there. In the beginning, which is very few cases, the idea that you had COVID,
true.
Oh my goodness, you can't come back to the community. That, I think, thankfully for them, that does not exist anymore. But the reality is the overwhelming of healthcare systems, which is what we've tried to avoid from the start. We need to get the numbers down, otherwise that's exactly what will happen, and all of us will suffer. All of us.
And of course, for those who perhaps have had the severe illness, COVID-19, the sort of side effects or long-term effects that they are experiencing. Because I know some individuals who still complain about the difficulty, and they've had it. So 9 months ago they had it.
So long COVID is a thing. It's a real thing. So the idea that I'm going to take my chances with COVID-19 is not a reasonable option. So yes, you can get some sort of immunity if you do get COVID, but the immunity provided by the vaccine is significantly, and it lasts longer. So the immunity, we have had reinfections here in St. Lucia, and that's something to be taken into account. So even if you've had COVID-19 before, you can become reinfected. And the reality is COVID lung, that we physicians are seeing the changes on CT scan and x-rays in the lungs of those individuals who've had COVID, brain fog, and so many other symptoms of long COVID.
And we're being joined by Honorable Jeremiah Norbert. You can come to us and let us have a quick word with you there. Thank you so much for coming through, and we're very, very happy to have you. And taking the Pfizer vaccine, because some would say, why not? Why didn't you take AstraZeneca when it first came, the first batch of vaccines we had? What made you come at this time?
To be quite honest, I did not have any issues with the AstraZeneca. I mean, it's obvious that I had undergone some medical procedures which did not permit me at the time to have the vaccine, so I was waiting on the go-ahead from my doctor, and I was anxious to get the go-ahead. I mean, we can see that the effects of COVID, what COVID is doing, and I mean, COVID is real. Sometimes we may play like not to underscore the effects, but COVID is real, and I have friends who have been affected by COVID. I know some of the people who have lost their lives of COVID. So I think we as leaders of society, we have a responsibility to also lead by example. So I would like this to be an encouragement to my constituents and to other St. Lucians. We need to be vaccinated. I'm happy that the Prime Minister has made it, he's giving people a choice to get vaccinated, but encourage people today to come out there, do the right thing, and get vaccinated, because I mean, it's better to have the vaccine, to be vaccinated, and not need it instead of needing it and then you don't have it. So we have the situation right now where we see the rising numbers in COVID cases, and I think this is a cause for concern. Despite it being a cause for concern, we are blessed in St. Lucia to have the vaccine at our disposal. So I mean, we can end this problem by encouraging other people out there to get vaccinated. So for me, I was looking forward to today, to being here, to getting a vaccine and to moving on, and I would like to encourage all people, especially the constituents of Mikudnov, to do the honorable thing and come and get vaccinated also.
So the Honorable Deputy Speaker of the House is telling you to do the honorable thing and get vaccinated. Do your part, follow the protocols. It is really the best way out of this pandemic. But before we let you go, just how do you feel? So you got your jab. We know men generally have a little fear of, needles. How was that?
You see, I have been, my entire life I've had a phobia for needles. My entire life I've had a phobia for needles. Nurse Dolo, I think I must say kudos to her. I did not feel a thing. No, I'm serious. I did not feel a thing. I literally did not feel a thing. So I understand, yes, some of us have a little phobia about the needles, but I can tell you, and I can tell you because I had first-hand experience, that the nurses who administer the vaccine are well-trained and very light-handed, so you barely feel a thing when you get the jab. Oh, yes, yes, they are. They are.
All right.
Yes.
So thank you very much, Honorable Jeremiah Norbert. So I think we'll complete your 15 minutes of observation. And then again, very inspirational figure you are. Thank you again for your service. Thank you for inspiring so many young solutions.
Thank you, Dr. Clarke. Thank you, Lisa.
Thank you so much. Right. Thank you so much. It's really good to see you about.
Yes.
Yes. And you're right, definitely an inspiration, story for all of us.
Absolutely.
Never giving up.
Never giving up. A story of resilience.
Yes, life is going to throw you some curveballs. It's going to be scary when
life
you
are.
Life is
going to throw us COVID.
Yes. But what you must do is stand.
Yes.
And you just need to just stand.
And when you have a tool to fight it, because COVID really has done so much to all of us. And again, you hear the argument, how come they had the vaccine so quickly? And these are the conversations that we need to have. That essentially, if it takes us the same amount of time in 2021 to develop a vaccine that it did, as it did in 1950, then we're not doing our jobs. Not using techno. We can do better, and that is why science evolves. The way we used to treat kidney disease now is not the same way we did in 1950. So that's why patients are surviving longer, and so many of the pathologies.
So we use the technology. Yes, and trust that technology.
Stand on the shoulders of giants, essentially.
Yes, and we just have to keep adding, and you're very correct, because discussing the Pfizer biotech vaccine that we have here is just one of the 2 mRNA technology vaccines, and I was reading that this is not new. A lot of people believe that mRNA is new technology, but has been tested before with people in cancer. And we know from back using it in that methodology that the complications, there aren't any of that. There's not anything of significance being recorded from those trials. So we can tell that, yes, the concerns are there. Individuals,
some legitimate.
Yes, legitimate concerns. And of course, things will vary depending on individual to individual, because no two bodies are the same. Yes? And so we still have a number of individuals pouring through.
Coming in. My sister was supposed to be here. She's running late, as usual, St. Lucian. She's a lactating mom, and we do think that is important.
In the family?
No, I'm always early. I'm very British style.
Okay, very British.
I'm very British. Early. And a lactating mom. And we want to encourage, you can get vaccinated. The interesting thing about this is so many people with chronic diseases believe that because I have a chronic disease, I cannot or should not get vaccinated. And we'd like to dispel that myth as well. You certainly can and you certainly should get vaccinated, St. Lucia.
And so for the lactating mom, if you can expand on that, because certainly that's a concern. Individuals who are pregnant, they tell you, oh no, I just wouldn't, because the unknown, because they're thinking of the unknown variable. How is this going to affect my body, and then I'm passing it on to my child?
So listen, with science, it's a question of trials, it's a question of studies, it's a question of populations. So why is it now that in the beginning you couldn't give it to children, and now you can, because the trials for that age group had not been completed. So once the trials are completed, then you have the data that you're not having adverse outcomes or negative side effects, that you can give it. So if you're pregnant, it's a question of having a conversation with your obstetrician. That is it safe for you? Because even with Pfizer, we've seen a few cases, and there's been a lot of talk about that, of what we call myocarditis or pericarditis. But it's
what is that done for us?
That is just inflammation of different parts of the heart, but there have been very few cases. So you can have millions and millions of doses of vaccine administered, and a little over maybe 1,000 or so cases of that in the UK, the US, but very mild, and all those patients have done very well. So again, when you look at the number of patients vaccinated, you hear a lot of talk about people dying after they receive the vaccine. That is not so. Here in St. Lucia, we've had absolutely no deaths because of the vaccine. The fact that you got a vaccine doesn't mean that you can die or something else. And I think that's what
it's
people
not necessarily that the vaccine killed you
at all. So we understand the concerns. We want to let you know, and I think I speak on behalf of the whole medical fraternity, that we understand your concerns. We will continue to consult. We're a little back low right now, but we know we have to do the consulting along with the Ministry of Health. We have to talk to people. We have to hear the concerns, and we commit to doing that.
But the more common thing that we're hearing, although the scientific community says it's rare, but it's still the more common complaint, is the blood clots.
Yes.
So why do we have the blood clots occurring in some individuals?
So that's sorry, I blocked my face. Can you imagine this? Are you definitely I need a professional? And that's a particular concern with the AstraZeneca vaccine, and that's why there's a bit of hesitancy with that in some individuals. Again, risk and benefit. Firstly, the risk of a clot is 0.00. I think there were like 7 zeros, 4% in somebody who's received the vaccine. There's a particular gene that was found, particularly in young women that of those that they've seen clots which they could relate directly to the vaccine, that was seen it. But the number is so minuscule and so insignificant. So there are jurisdictions where they say, you know what, let the younger women perhaps take Pfizer. And that's why the options are important. If we're not doing that gene sequencing, let's let them take the other vaccine because we're not sure. But the risk is quite low, because I would like to tell solutions that a patient getting a heart attack, because interestingly enough, the odds of getting the clot, so a heart attack or stroke with COVID-19 is significantly higher. We're looking at 16%. And that's something else that we're seeing even months after patients have recovered, that you can see clots in those individuals. So again, risk, benefit, it is safer to get vaccinated than to get COVID-19.
All right, and so we think about COVID, we think of it only in sort of vacuum, and we think, well, it's COVID-19 as an illness within itself, but you've just been there about
Kidney
a heart attack
disease,
triggering that.
Yes.
So it definitely means that getting yourself protected prevents you, takes you a long way away from having to deal with all of what those possible the triggered illnesses.
Absolutely.
And we now have at the station there, we have Dr. Robert Lewis, who is there with his son Ayani, getting vaccinated. We'll be able to have a conversation with him quite shortly when they're through over at the nurse's station. And we can see that individuals are continuing to pour in. The interest is high for the Pfizer vaccine. Very
encouraging. Because I think, again, recognizing your duty as a citizen of St. Lucia to do your part. We really don't have very many options. And as you said, we really have to be grateful to science, because last year, of course, March, April, we were speaking of, will we have a vaccine in time? Yes. Will it be 2 years? Will it be,
because so many conversations. The cry was for the scientific community to hurry and get something, and then it came, and then the cry was, why so fast?
Different. So it can be disheartening, but we understand that these things happen. And the age of the internet, that wonderful place, the internet, it's a source for good, but also it could be a source for so many things not so good. And understanding the information that you read, as I said, that sometimes just discerning and trying to decipher, trying to mix information can be confusing, even for us physicians with the science background. So I could imagine how confusing it is for individuals who don't even think that it's confusing, that you can't just take all at face value. Remember, anybody could put anything on the internet, and just because it looks scientific doesn't mean that there's a necessary scientific rigor. So that sort of thing is important, and we have to take that into account.
You know, I want to ask you if you can answer, why is it that, particular variants, and that with the Delta, we've seen that the Delta easily being able to affect younger people, but the British variant or COVID itself, COVID-19 itself, did not have that ability to affect the younger people as much as the Delta variant?
Listen, the reality is the same way we want to survive, animals want to survive, viruses want to survive. And so viruses mutate. It's not new to COVID, it's not new to SARS-CoV-2, I should say, which is the virus which causes COVID-19. There are mutations, and the mutations in the virus are always aimed to make it more efficient at surviving. Now, the virus's survival is to our detriment in essence, or to the detriment of the host, be it the animal or the human or whoever it is. So the Delta variant, what has been seen is that the viral load tends to be a lot higher. So because there's so much virus, the ease with which it replicates in the sense is faster, then you can become infected easier. And because your viral load, as with every virus, if you have a high viral load, then your odds of infecting somebody else is the same with HIV, it's the same with so many other viruses. The odds of passing on the infection are higher. That's essentially what we are seeing with this variant. But again, efficiency, attack more robust immune systems, which is why we're seeing the younger people being affected more, and there very well may be more variants. We don't know. But the reality is, when you look at trends in viruses, it's why you need a different flu vaccine every year. You have to look at what strain is circulating. And that's what we're hoping for, in a sense, in the scientific community, that COVID will become somewhat like a seasonal flu, because it's probably going to become endemic. It's probably here to stay. It's a question of it not overwhelming healthcare systems as it is right now. That is done.
So they did with that Brazil. There's a variant in Brazil as well. And so we're not experiencing it here in the Caribbean, but it certainly circulates in
variants. Viruses
in
and variants
America.
go hand in hand, essentially.
All right. So we do have Dr. Robert Lewis.
So as cut over
with us,
the two of them,
and with his son. And yes, come on over. Come and have a nice little chit chat with us, if you may. So Ayani, absolutely. He is the man of the hour, Dr. Robert Lewis.
Clearly.
And that is you. Yes, by all means, please join us. Thank you so much. It is very good to see you. We've crossed paths in a while. And you are here, bringing in young Ayani. How old are you, may I ask?
I'm 15.
15 years old, and he's certainly outranking you in height. Okay?
Well, we're not even going to. There's no competition there.
So for you bringing him in, you are vaccinated, that I know.
I am fully vaccinated.
For sure.
Yes.
And so you did you have a conversation? They said, listen, I spoke with my child about their own decision to take the vaccine.
Well, yeah, we've had decisions about that, and I suspect Ayani can say. We've had discussions because the daughter was at the first shot of the AstraZeneca, because I believe that they ought to realize that what they have to do is to follow what the protocol says and try to do what is being asked of us as citizens. So Ayani really, we've had discussions, but Ayani, we didn't have any kind of arguments, because I think Ayani just accepts the fact that
this is what's going to happen.
Yeah, I think he can speak.
Ayani, talk to us about that, and what was some of the thoughts that you had about the vaccine and COVID-19 as a whole?
Well, when my parents told me that I would have to take the vaccine, I was open-minded about it. So I realized that it would just have to happen because we're going for a pandemic, and the vaccine, they brought it out just to keep me safe. So it's best that I have an open mind about it. I read a little bit about it. I decided that it's okay that I should take it.
And I'm very happy that you made that decision to protect yourself, the rest of your family, and St. Lucia as a whole. What school do you attend?
I attend the St. Mary's College.
And are you eager for you to be able to have face-to-face classes again uninterrupted?
Yes, that would be good. Going into my 5th form, I would really like to have face-to-face soon, because I believe that I learn better in a face-to-face setting. But despite the online setting, I have to adjust to can learn better.
Yeah, and we've heard that from some students. Some of them love the online. Other individuals really like that in classroom setting, because they feed off the energy of the teacher and the other students. And so going into your fifth form. Are you concerned at all that the sort of interruptions that we've had in the last year or two, that it would have had some impact on your ability or for you to grasp some of the concepts in your subject areas?
I'm a little bit concerned, not to the point where it troubles me that I can't at night. It's just concern as in saying that I might not grasp certain concepts fully, but I would have to try my best so that I can grasp it for the upcoming CXC examination.
All right, I want to thank you so much there, well-adjusted young man that you've raised, Dr. Lewis. And how do you give him the sort of encouragement? How do you encourage him? Because it's been a difficult.
Well, yeah, I mean, it's difficult for parents, but I think most young people, if they think the parents are trying to direct them in the right path, they will do what ought to be done, because essentially I think children look at you as more, so they can choose what it is. They may not always do what you say at all times, but at least if they think they watch you every day. And I think I was just reading Colin Powell's book where he says the whole idea is your children are going to watch you, and if they see you doing certain things, they're going to model you. They try not to get you embarrassed. And I agree with that, because that's how we grow up. That we know parents are very critical for their children.
Yes, the power of example is very, very important. Yeah. I want to thank you so much, Dr. Robert Lewis, and his towering son, Yanni Lewis. Thank you so much for doing the right thing.
You're welcome.
Thank you very much, Lisa.
Thank you.
Yes, thank you so much. And as I indicated, we are dwindling in the numbers, but we've had a large number of individuals coming by for today. The nurses station over at the sort of observation section that we have. So a number of individuals still being observed there by the staff. Just getting some other notes. We do have Dr. Kim Gardner Sadu. She's here. She's a pediatrician, and she's here with her daughter, who is Anya Sadu. So I'm going to just scoot away for you. No scoot. As we do a little transition, so we can have a little chit chat.
Logistics. Hi, good morning. How are you? I haven't seen Kim in a while. Again, what COVID does to people, we don't see anybody anymore. You're working home. How are you doing?
I'm good. I'm very relieved today, actually,
Absolutely.
to get the first shot in her arm.
So as Lucia said, you're a pediatrician.
So
again, the importance of that. So as a pediatrician, speak to, again, the parents of our target audience in a sense today, or younger people.
As a pediatrician, vaccines are the bread and butter of what we do and what we believe in. And, for almost a century, vaccines have been preventing disease in children and in adults. So it's a fact that vaccines do that, and therefore I have looked at all of the research, the data, made the decision for myself months ago to get vaccinated, and knew as soon as it was available for my children that I would. So I'm very grateful and relieved today, and I hope many more people take up the opportunity to get vaccinated.
All right, and what's your name?
Anya.
Anya. How are you, Anya?
I'm good.
Anya has a lot of energy.
Yes.
Posture.
I'm very excited.
Yes. How old are you?
I'm 12.
You're 12. So tell me what the conversation was like with Mommy the pediatrician. What was the conversation like with reference to you getting vaccinated?
I wanted to do it to protect me and other people around me.
The absolute conviction with which she says that. And I mean, from the mouth of babes, really, if Anya recognizes the need to do this, to help her country, to help her get back to normal, are you good with the online schooling, or you prefer socializing with your friends and that sort of thing?
I prefer socializing, getting to talk to them.
Absolutely.
And she's transitionary school, which is an important time in her life, and I don't want the first year of her schooling to be virtual. She has new friends to make and meet new teachers and learn a new environment, and it's important.
Best chance of that, of course, as we know, is vaccination. Which school should be going to?
Convent.
Convent. What's your house?
St. Anne's.
Best house, Blue House.
Please know that I had my Maria list. I thought we were going to get away with me not saying, because of course the SGC virtual pageant is coming up, and the importance of that so much about, but I figured I'd sneak the opportunity to talk about it a little. So you both St. Anne's girls. I think think they put the moms and the daughters in the same houses because Dr. Belma's daughter is in her house.
Oh, really? Yeah, I'm relieved because my mom was in Goretti, so I didn't get to go in her house. But yes.
So are you excited? Because again, there's still the conversation that needs to be had. In fact, we don't know yet when school is reopening. I mean, just the anxiety of all of that. We said the mental health impact of the children. What are, in your conversations with children, you're the pediatrician, used to the children, about COVID, what are they saying? What are they feeling?
Yeah, it's such an abstract thing for them to wrap their heads around because, you know, you can't see it, you can't touch it, you can't feel it. But I think there's so much information out there that they're getting from many sources and from their own parents, and it's hard for them to synthesize it. Yeah. So the main thing is just keep it simple, use a lot of visuals. When I talked to children about it, I went and talked at their school and other schools and, you know, make it kind of animated and talk about it. And the most important thing is to live and answer the question because there's a lot of misinformation. Yes. So, but the message is both the, you know, the 6 feet apart, wearing your mask properly. Children from age 2 can wear masks appropriately, and it doesn't have any impact on their development. So there's evidence to that. So I think we have to start educating our kids. I said yesterday, funnily, that we should start immunology and physics in for the crate challenge in preschool.
Can you imagine?
But yeah, it's just so much coming at them through social media that we as parents have to be on top of the information that they get and try to synthesize that. If you can't do that, then you go to someone who you trust, your pediatrician, your community nurse, someone who can help you with that information.
All right, so we let Anya have the last word. I love your energy, Anya.
Thank you.
Speak to your parents. Just tell them why you think they should get vaccinated and how you're feeling okay, right? Perfectly fine. Just tell your parents something to your parents as to why they should get vaccinated to do their part for solution.
You should get it to protect not only yourself but others. And as the people like me going into secondary school, you should be like protected.
Absolutely. All right, so thank you very much, Anya and Dr. Kim Gardner-Sadu. Thank you for being here. Thank you for speaking to your peers and solutions. We urge you to take the advice of our pediatrician colleague, Dr. Kim Gardner-Sadu, and her beautiful, enthusiastic convent girls and dance daughter, Anya. Thank you very much.
Thank you.
Thanks, Dr. Claire.
So Lucia, calling Lucia, my BFF today.
Yeah, always BFFF.
BFF. So yeah. So let me see. Do we have anybody at the table?
No one at one individual, but we are very came through today. Absolutely. And certainly St. Lucians have shown that they are very, very ready to be able to continue in that national fight, not only by observing the protocols, but coming, getting vaccinated, and of course now with the Pfizer. I tell you that from our offices, from the GIS offices, we can stay and look down at the VG Sports Complex when they are there and see the numbers. The parking lot there, absolutely filled, individuals, and they will wait very patiently, and we can see that St. Lucians, the concerns, and the concern there is really the concern to getting St. Lucia back on track.
Absolutely.
Getting our lives back to some semblance of normalcy.
That's why we're doing this. It's not just a question of we want to get you vaccinated, it's how we all want to get back to normal. You want to get back to normal. And this is how you play your part. Adhere to the protocols, get vaccinated. That really is the only way for us. Again, Dr. Sadu mentioned, I think it would be remiss of me not to mention, I think our PRO is putting out a press statement today, this crate challenge. Really? Really, we do not need this right now. I mean, it's really just another way to have potential trauma, and we want to avoid it. So please, St. Lucians, we ask you to refrain from participating in this crate challenge. Listen.
Yes, the challenges keep coming, but St. Lucians always exercise due diligence, everything they're doing. Just to make sure that you ask yourself the question, would I really want something to that's going to hurt me, hurt my family, hurt friends? And no, you wouldn't want that. Just pause for a minute. Just pause and reflect a bit on any decision that you have to make, and if it's going to create injury to yourself or a loved one, it's not the right thing.
It's a no. That's a no.
It's a no.
Yeah. We're fighting one battle, and that's with COVID-19.
That's COVID.
Let's do that.
And COVID-19 is proven to be quite a force.
Absolutely.
And so we need all of our energies. We need to challenge all of our energies together in order for us to make a dent and have COVID-19 go away.
Yeah, go away COVID-19.
Go away COVID-19.
Yeah.
And the vaccines are here
Yeah.
to help us do that. And so with the Pfizer vaccine, that's continue with the rollout alongside the AstraZeneca as well. So don't believe that right now it's only the Pfizer that's available to you. We do have some AstraZeneca vaccine still. So when you call or you walk in to the vaccination site, you can ask and you can have a discussion with the healthcare professionals there. But we also want to say, in addition to the site, individuals, you can walk in or you can call the community wellness centers or your health centers, as we say.
Yes.
You can do that in order for you to be able to get access to the vaccines, because it's not always convenient for you to go to the public days for vaccination.
And some of the private physicians also will be vaccinating, so assistance was sought for that. And some of our members, recognizing the importance of this and recognizing the need to have all hands on deck, will be offering vaccinations, and that will be advertised also on the ministry's, at the Bureau of Health Education's website. So just keep your eye out for when, or just call your physician. If you do have a private physician and you choose not to call a wellness center, you could call your private physician and they will be able to supply that information to you, St. Lucia. We really are trying to make this as easy as possible.
As easy as possible.
As seamless as
making
possible.
it even easier, the Ministry of Health has also partnered with People Discount Drugstore.
That as well.
So that you too, just being able to give you options for you to be able to access the vaccine.
Look at it easy. Look at it easy. Say Potter.
All right. Whatever she said.
Yes, whatever.
So we want to thank you so much for tuning in to this broadcast where we brought you public vaccination drive for Pfizer vaccine. Thank you, St. Lucia. On behalf of the Ministry of Health, Wellness and Elderly Affairs, I am Lucia Joseph.
And I'm Dr. Merle Clarke.
We'll be seeing you at the next drive.
Bye-bye.